Over 14 million Ugandans are estimated to be living with some form of mental illness, yet less than 1% of the national health budget goes to mental health. With a growing burden and limited funding, Strong Minds, a civil society organization, is pushing for scalable solutions like interpersonal group therapy, which empowers local facilitators to deliver care.
The government to help us be able to carry out a mental health survey for the country. We tried one during the census, but the kind of questions that were asked and the way you guys were responding was actually could not bring out information. The information did not come out very well.
And I fervently believe that the model that we've developed here in Uganda and in other countries through Strong Minds of democratizing depression treatment, creating simple tools that a community member can use, is really the key to treating depression globally. And that's something Strong Minds is so excited to do in the next 10 years.
Strong Minds Country Director Vincent Mujuni says they have provided treatment for depression to over 1 million people using a community-based therapy model. But the demand remains overwhelming.
How do we talk about 1 million people reached? It's because we changed the model. We empowered the teachers. We trained the VHTs. We worked with expert clients. We mobilized volunteers. We placed therapy in schools, in communities, in prisons, in churches, everywhere around. We treated depression not just as a disorder, but as a doorway to restoration, to stability, and to hope. We dared also to push for policy change.
Some who have recovered from depression shared powerful testimonies on how access to care changed their lives.
I'm a man, but most of the time I used to be just sad and crying. I was wondering I would be in Luzira for the first time. Now, not sleeping, not eating. I even one time said, how can I end my life in prison here? Now, but when I went through therapy, through the system of Strong Minds, sitting together in groups, talking about our issues. When I was talking about my issue, one of the colleagues said, Lawrence, I think you should not be here. Have you ever tried making an appeal? I said, no. What do you do?
I was really depressed, but after meeting Strong Minds Uganda, really, my life changed. I had a lot of depression. I was suffering for the case. I was thinking how I would get out after 17 years. In prison, I had lost my father, I had lost my older son. So it found when I was not able to eat, I was self-isolated.
The Ministry of Health acknowledges the need for stronger partnerships and scalable mental health care to address Uganda's growing treatment gap. Zahara Abigaba, UBC News.